Hello, my name is Dr. Todd Meyer. I'm an ear, nose, and throat specialist. So we see lots of patients that have problems with nasal congestion, nasal breathing, allergies, irritation to your nose, trauma to your nose, and those can also affect sleep, breathing, and activities of daily living. If you are having any of those symptoms, at Ear, Nose, and Throat Specialists of Wisconsin, we're here to help you with those issues. When you're seen in our clinic, the provider is going to review those questions, worries, and concerns with you, and then evaluate your airway and come up with a plan of care that's individualized for you. When you have nasal congestion, usually we try and use some nasal medications as our first option. If nasal medication isn't sufficient or changing things that might be a trigger, then sometimes you become a candidate for surgical intervention called inferior turbinate reduction. The inferior turbinates, they're a portion on the inside of your nose that help to direct airflow, and they can become congested and swollen, and if it's too big, it makes it harder to breathe. That happens when you get exposed to things that irritate the lining of your nose, such as allergies, smoke, perfume, chemicals that cause congestion. Inferior turbinate reduction can be done as an office-based procedure or in the operating room. There's various technologies that we have available, and our practice has all of them, including bipolar cauterization, radiofrequency, coblation, and submucosal reduction. Inferior turbinate reduction is sometimes done individually, and sometimes it's also done with septoplasty in combination to improve your nasal breathing. So septoplasty is a surgical intervention to improve your airflow by fixing a crooked nose on the inside and shift that back into the midline. So the majority of septoplasties are an outpatient surgery. You come in, go home the same day. Because we're working in your nose, the greatest risk is if you start to increase your activity too early, too soon, you could get a nosebleed. So we have you limit some of the activities such as bending over, getting your heart rate up, lifting heavy weights, and we don't like you to travel from the area just in case something were to happen that we could help you out. And it's generally about 2 weeks before you can get back to regular activity without restrictions. So our commitment is to make you feel better and also help to get better airflow so that you feel better sleeping, breathing, exercise, the activities of daily living, so that people live better and have a better quality of life.